particularly for myself. And I didn't start this way. If you met me a couple of years back, I probably won't be able to do what I'm about to do today. I trained as a physical therapist and I practiced as one for over 5 years, if not more than, before I left Nigeria to move to Canada. And along the line, I have a very genuine encounter with the Lord that changed the trajectory of my life. Unfortunately, I won't be able to talk about many of my encounters because we will use the whole time to talk about stories if I'm to talk about myself. So, but to keep it short, I met the Lord and the trajectory of my life changed. And when I came to Canada, I came with, big hopes, big dreams to, get into my profession, do something awesome with my life according to my plans, and not knowing that God had a different plan for me. And in the place of prayer, the Lord began to speak to us as a family, myself and my wife, to take our journey from within the city to move to a remote area, which I would call a village. And as at the last census that was conducted in that location, the population was actually less than 2,000. And so we had to move there. And I could remember one of my friends telling me that you might actually be the only Black person in that place. Why are you going there? And I need to say this, we came into Canada and we had my first child 4 days after we arrived. And it was just less than a month when this instruction came. We weren't even familiar with the terrain of Canada in general, not to talk of moving to a remote area where there will be no friends, no relative, no support of any kind. And that was the of beginning of our journey. We started from Nigeria and, going there without any form of hopes, humanly speaking, not even knowing how to survive through the month, not to talk of the next month. We were going not even knowing that we would have a place to, to lay down on. And I could remember reaching out to the landlord that was to give us a place to stay. And he took the area photograph of the old village and sent it to me. And he was like, "Are you sure you are coming here?" And, I had no choice but to just obey the instruction of the Lord. And I remember what the Lord told us then was, He said, "This is the preparation for the work that He has for us. It's a preparation for ministry." It didn't make sense to us, but we just had to obey. And we got there. The only thing we knew to do was just to spend time in the presence of God to pray. And in one of those days, there was no job, of course. In one of those days, as I was waiting on the Lord in the place of prayer, I heard the word drug and smoke. And I was like, what is the meaning of this? And you need to know that this is an aspect of life that I was never exposed to. What do you mean drugs? What do you mean smoke? And then he said to me, he said, "I will be with you." So I didn't know, what do you mean? I'm not going anywhere. You didn't even allow me to, to move around as much as I would want to. And a couple of minutes after, I got a phone call. And when I picked the call, the person at the other end said, "Are you going to be available for a job interview tomorrow?" And of course, you could guess my response. What did I apply for? So the person was surprised, not knowing that I was more surprised than, than herself, but I had to play along. Then, so she sent the address to me and all, and that was, the place turned out to be an addiction recovery home. And that was how I got exposed to the world of trauma and addiction. I thought it was just going to be a job, just like any other job. And I got into that space not knowing what I was doing. And I didn't get into the space as a professional. I started from the very beginning. And my first position, which was this one I'm sharing, was basically like someone that would, you know, I won't say a cleaner because I wasn't cleaning the floor, but I was packing plates, put it in dishwashers, arrange, get things together, and the lights. I was doing, what we would call odd jobs. And everyone would ask me, what are you doing here? When they know my qualification, you have this certificate. What are you doing here? Even the ones that were not educated, what are you doing here? And it's hard to say that um, this is the instruction of the Lord. I'm just doing it in obedience. But time actually tells, it reveals the wisdom behind that decision. Because in no time, a revival broke out in that place. And I saw the book of Acts of Apostle come on display, especially the sermon of Peter, when after he had interpreted the story of Pentecost, and the people said, what shall we do? I saw it come alive. The power of God broke out. I began to see the glory of God, not just in my life, even find expression as a presence I carry from one place to another. And he said to me, he said, the light that I've placed in you, I want you to allow that light to shine. And I need to tell you that I am yet to fully understand that statement, because every season of my life, it finds different meaning. And this is one of the expression, which is the School of Transformation. And this is a maiden seminar to open up the School of Transformation that focuses majorly on helping people that are struggling with trauma, addictive behavior, to come out of that place, end that suffering and pain of trauma, and find their true identity, find their purpose, and build the discipline that is required in order to journey through life in a victorious way. This is what the School of Transformation is for. And I believe that at the end of this seminar, a number of us, if not all, will be convinced that there is a need. It's not a one-man thing. God is raising an army of people that will go out there and plunge um, and spoil the kingdom of darkness of every soul that has been trapped within that realm, so that we can populate the kingdom of God. This is a little story that begins my journey into the world of addiction, and I've been in that field for about 5 years plus now. And it has been a forward journey. I've learned a lot. I've seen a lot in my work with God, in my relationship with people, supporting people, seeing different approaches that are being used to support individuals that are going through these challenges. And I've also seen the transformative power of the gospel of God. And I've seen the difference between sobriety and freedom. And what I bring today is to introduce us to freedom, not sobriety. And I pray the Lord will help us in the name of Jesus. So bear with me as we journey on this um, part. And if we have any question, please feel free to put it on the comment section. And there is going to be a Slido link in the comment section as well, that if we want to post our question anonymously, we can actually put it on that link, and we'll be able to gather the questions and respond to them. It's a 2-day seminar. Today is the first day, and we are going to continue tomorrow because we have a lot to cover. And I don't want to rush. I really want to bring everyone along so that we can understand the issue of trauma and addictive behavior. So if anyone has a question, you can ask now before we begin. I will just check the comment section to see if there is anything there. Okay, it looks like we are good. So our objective for today and tomorrow for the course of this seminar will be that we'll be defining trauma and traumatic events. We are going to be looking into childhood trauma. We are going to be talking about the impact of trauma. We are going to be uncovering the root of trauma, which I believe is very important. We are also going to be looking into the relationship between trauma and addictive behaviors. We are going to be redefining re traumatization. That is going to be interesting. We are also going to look into the cycle of addiction or addictive behaviors. I'm going to be talking on the subject of compartmentalization. This is a new approach and is going to be very interesting. There is a danger that comes with it that we are going to be looking at in the course of this seminar. And of course, we are going to be uncovering the pathway to freedom and the importance of community in freedom. Um, this is a lot. If we are not able to finish everything during the course of this seminar, it then means that you have to come to the School of Transformation to finish it up. And it would be nice to have everyone there. The School of Transformation is a coaching program that runs for 3 months and it captures the 4 areas that I mentioned earlier. Okay, we can go into the seminar now. I'm going to be starting by defining trauma. What exactly is trauma? What is trauma? I believe every one of us, we are familiar with that term, trauma, but the word trauma is originally not an English word. It's actually from a Greek word and it means wound. It means wound. And when we talk about, and this talks about any wound, it's not, it could be physical wound, you dash your feet on the stone and, blood gushes out and, oh, that's a wound, is trauma, but it's a physical trauma. But the trauma we are talking about today is not a physical trauma. We are talking about a wound that happened in an hidden place that might not be visible. And as a matter of fact, that is not visible to the eyes of humans. But then the symptoms of that wound is felt all around. So if I'm going to define trauma, I would say trauma is a long-lasting emotional wound left behind by a distressing or disturbing event. That is very important. Distressing or disturbing event that overwhelms an individual's ability to cope. And the event itself is a traumatic experience, but the wound that that event leaves behind or the scar is what we call trauma. And a typical example is maybe an individual has a motor vehicle accident. The event itself is what we call traumatic event. But the event, you realize that there is a ripple effect after the event. That ripple effect that changes everything. Sometimes for many days, you might not even be able to sleep very well, have insomnia, have flashbacks, intrusive thoughts. Sometimes a little sound, you remember the event and you get startled easily and stuff like that. Those are the symptoms of the wound that that event left behind. And it is that wound that we refer to as trauma. The effect of trauma can be short term and it can be long term. And what determines if it is short term or long term depends on three major things. And I need to say this, if there are no intervention, it is possible to carry the scar for a lifetime. And that is why it is very important to not just talk about trauma, but to understand it for ourselves so that we can evaluate our life to see if there are limitations that we're experiencing in and around our life that might be as a result of trauma from a traumatic event. So there are three factors that actually determines if the effect of the event, which is the trauma we are talking about, is going to be short-lived or is going to be a long-lasting one. And these three factors, I'm just going to list them. The first one is the nature or the type of trauma. We are going to go into that at some point, so I'm not going to talk about it now. The second thing is the personal resilience. There is a uniqueness that comes with every individual, the way you interpret things, the things you are able to accommodate, I might not be able to accommodate the same. In that case, if both of us we are exposed to the same traumatic event or experience, our response to it might be different. For maybe someone like me that I'm more sensitive than you are, the effect might be long lasting because of that sensitivity. And for yourself, you are not as sensitive as I am, the event might not be long lasting. It might just be short lived and you are over it. So that's another factor that determines that. And the last one, which is very important one, and as a matter of fact, the most important of this factor is a supportive relationship, having people around you that are not just willing to support, but know how to support, that understands what you are going through, that are able to meet you where you are at and provide that support. By the time we look into childhood trauma, you begin to see how important this supportive relationship is when it comes to the effect of trauma or traumatic event in the life of an individual. And I need to say this, every one of us at one point or the other, we have experienced a traumatic event. I know some of us may not believe, you will be convinced very soon. So, when we say something is a traumatic event, what we are actually saying is that that event involves an actual or perceived threat to an individual's life. It means your life is threatened, your survival is threatened. If anything of such happens, it means you experienced a traumatic situation. It doesn't matter how small it might seem like. It's interesting because what you might call traumatic, I might not call it traumatic. Again, it boils down to sensitivity. And the fact that I do not count it does not negate the effect of that event in your life. And that is why when we talk about supportive relationship, we are not just looking at someone that is available and willing to support. That is wonderful. But we are also looking at an individual that understands what is actually happening, the gravity. You know what I mean? The weight of or the impact that that event might have in the life of an individual. So an example of traumatic event could be an accident, it could be a car accident, it could be industrial accident, it could be from a fall, just like you see in the photo. And it could be violence, physical, sexual, domestic, witnessing loss, and stuff like that. I'm still gonna go into a number of them. It could be war, conflict, maybe people that are veterans, they've been to the war front, seen, lives of people being taken, or even they themselves, they barely escape from situations like that. Conflict within the family, refugees, and, a lot of things along that line could also be categorized as a traumatic event. We also have natural disasters like floods, hurricane. There are many people that are displaced from their homes at one point or the other, and earthquakes and the likes. They are also traumatic events. And the subtle one, yet the impact is very deep, is abuse and neglect. We are still going to look into that as well. And I want us to know that when we talk about events in general, there are two forms of events that we can actually experience as an individual, and there is no way you can escape it. And these events are what shapes our lives. The first one are the prevailing experiences, and the second one are the traumatic experiences. And this is what shapes our lives. You can use the word encounters for it, and they can come in different forms. It could be a spiritual experience, it could be a physical experience. And the nature of the experience doesn't really matter, either physical or spiritual. But what is important is that it can shape, as a matter of fact, it shapes the life of an individual. It shapes your interpretation of life, the evaluation that you have of yourself, of others, even your view of the world in general. And it also determines the trajectory of your life. A typical example is someone that experienced something traumatic will build a defense system around that in order to prevent themselves from, being exposed to that event again. And there are many things I'm still going to say regarding that, but I'm just saying this so that we know that these experiences actually shapes our life. It doesn't matter the life you are living now, they are shaped by either or both of these experiences. The prevailing experiences, which are the positive experiences that we have in life, and then the traumatic experiences, which are the negative experiences that we have in life. And the way we respond to these experiences could be different. So let's take note of that. We are going to come back to this slide at some point, I believe. So it would be nice to remember that. So, types of trauma. We have three major types of trauma: acute trauma, chronic trauma, and complex trauma. Acute trauma means maybe a one-time event like a motor vehicle accident, and usually when it's acute, it can be short-lived. And again, it depends on how sensitive the person is. For some other people, it can even be long-lasting. In chronic event is a repeated experience of the same incident. A typical example is someone that experienced maybe sexual abuse consistently, but it's just sexual abuse. Is a chronic traumatic experience. And then the last one, which is the one we are really going to delve into, is the complex trauma. Complex trauma results from exposure to multiple traumatic events: motor vehicle accidents, sexual abuse, emotional abuse, neglect, and the likes. There are a number of traumatic experiences of different natures that, an individual experience. And this is the one that I believe we are going to really delve into and, just help us to understand. And if we can understand complex trauma, then it will be easier for us to actually deal with situations of chronic and acute trauma. So I would like us to go into childhood trauma, because most complex trauma actually starts from childhood. And many of us, we may not understand the gravity of some of our experiences, how impactful those experiences has been in and around our lives. And as we look into childhood trauma, some of us will begin to see ourselves, will begin to see our experiences. It's not an attempt to downplay your experiences or make you feel like, oh, I experienced the worst or the bad or the good or the better. This is an opportunity for us to reflect and ask ourselves questions. In our walk with God, for those of us that are Christians and are passionate about our walk with God, you will understand that you will get to a point that you will need, in order to move forward, you will need to go back. And in order for us to waste, and this is where many of our journeys as a believer we get stuck. We don't know how to move forward. And if we can follow through with this, maybe it will save us a couple of years to know how to deal with this aspect of our life. Because I can assure you that I have a fair share of mine, and I'm still going through that. And the Lord has really helped me a great deal to be able to self-diagnose myself and evaluate and subsequently reevaluate myself in order to see where I'm at, the ground that I still need to cover, and how far I've gone on this journey. So I would like you to follow me as well and have it at the back of your mind that this is a tool for self-evaluation, for self-reflection, in order for us to be able to know where we are at, know the steps to take in order to move forward. Okay? So I love this quote, and you'll see it a number of times as we proceed. And I believe it's very important because we live in a world that there are so many distractions that put us in a state of denial. We try to deny some of our experiences. We don't question them. We are not curious enough to look inward and find ourselves or question the things that are happening within. We have been, occupied with so many things that are happening outside of us. Even having a cell phone can keep you busy that you can't even monitor the thoughts that runs through your mind. And because of that, I put this quote here as a reminder at every stop in this presentation. By the way, we are going to have a break at some point, and we'll have a breakout room where we'll have the opportunity to just spend time with each other and deliberate on a few things. It says the curiosity is the biggest thing when it comes to recovery. The willingness to explore self and ask questions, the willingness to let go of ideas that no longer serve you. One of the things that characterize trauma and addictive behavior is that individuals that are victim of this, they have limiting belief system that no longer serve them for good, but they are still unable to throw it away, or as a matter of fact, unable to identify it. So curiosity brings us to that place where we look inward to explore ourselves and to ask the right questions, to challenge our belief. Why do I even believe in this? Why am I like this? Why am I doing this? What is the inspiration? How did this even started? You see, it is easy to see um, an individual struggling with alcohol addiction, and then you are wondering, why are you like this? Why don't you just clean up and leave this behind you? As a matter of fact, you will cause more damage with that advice than do any good. Curiosity is the biggest thing when it comes to recovery, and I want us to take that home. And this is a quote by Gabor Meti. He is an addiction expert, a man that himself had gone through a series of trauma that he's trying to recover from, and is also a medical practitioner that has worked with a lot of people dealing or coming out of trauma and addiction. I want to show us these statistics so that we can know how important the things we'll be discussing today is. And it's interesting that when you look at these statistics, you question why these things are not being spoken of. I was having a conversation with someone, and I said, it is very easy for us to go to the hospital when we have, physical challenges, like you have headache, malaria, wound on different part of your body, broken bones, and stuff like that. And you have there is nothing pulling you back from actually going to see a doctor and tell them everything about it. But when it comes to emotional wound, psychological wound, the society has actually not created that safe space for us to express ourselves the same way we will do when it comes to physical ailment. And this actually speaks to why we have this kind of statistics. It means a lot of people are dying inside. A lot of people do not even know what is happening to them, and it's killing them. A number of people committed suicide because of this. They could not even explain what is happening. They could not put name to those experiences, to the emotions that is coming out of them. They just know that this is not who I want to be. Yet I kept on repeating this over and over. What is happening? And then they keep asking themselves questions. And you can only think within the scope of your knowledge. If you don't have the answer, you don't have the answer. And the society does not create that safe space where you can actually outsource the knowledge, especially just like you can walk to the hospital for physical ailments. The stigma is there. I mean, in this part of the world, the Western part of the world, there is sensitization going on gradually. But I can tell you that it's still not making a lot of difference. And I'm speaking from experience due to the fact that that's the field that I work. So when we look at these statistics, the first one is a study that was carried out in Southeast Nigeria over in a higher institution in Southeast Nigeria. And look at this, 86%, 86.7% of the participants have actually experienced adverse childhood experiences. By the way, ACE, you see there is another name for childhood trauma. It's adverse childhood experiences. 86.7%. Can you imagine that? 14.8% has experienced one adverse childhood experience. 30.5% has experienced 2 to 3. And 41.3% has experienced more than 4 of those experiences. 85% of the youth have experienced at least one form of sexual abuse during childhood, and females reported higher number of these than males. And I take it a little to cover a larger surface, larger area rather. In sub-Saharan Africa, about 72% of females and 82% of males have experienced at least one form of childhood trauma or maltreatment, with 20% of female and 24.2% of male experiencing 3 or more of these experiences. And this is a recent one. This is from April 2024. For every 100 adults in England, 48 have suffered at least one childhood trauma during their childhood, and 9 suffered 4 or more. This is roughly 50%. Nearly 2/3 of US adults, that's 63.9%, experienced one or more adverse childhood experiences as of last year. In Canada here, about 6 in 10 individuals reported experiencing some type of child maltreatment before they were 15 years of age. That's 59.7%. This is how prevalent trauma is, childhood trauma. And it is interesting that most of these studies were not carried out in children. They were carried out in the life of this participant as an adult. And they carried the symptoms, the impact of their childhood trauma up into their adulthood. When we go forward, you are still going to see how this trauma impacts or could impact the life of an individual. So I believe this should help us to see how important it is to actually address this topic and bring people to understanding so that the society at large can be enlightened, can be sensitized, and the stigma that has been built around this can be taken off so that the people that are victims can receive the help that is needed to walk the path of recovery and even freedom. Again, childhood trauma is also known as adverse childhood experiences. And according to Centers for Disease Control and Prevention, adverse childhood experiences are potentially traumatic events that occur in childhood between the age of 0 to 17 years of age. So within this, any traumatic experience that happens within this age range, we can refer to them as childhood trauma or adverse childhood experiences. I'm going to show us three categories of these experiences, and then also to go down to the subcategories so that we can actually begin to understand what I've been talking about. I know some of us might